Toxins. Well, my journey started when I was pretty young with amalgam fillings, which were put into my teeth without any care. And they were drilled out and replaced and added and very unconsciously started to pollute my body in a big way. Then I had an accident and crashed my front teeth, which means metal pins had to be inserted, which then caused a reaction between the palladium and the amalgam fillings. And then I had 2 crowns and the whole thing went haywire. Mercury was released in huge amounts into my body until we decided we take them all out without any care. And that's when everything collapsed. I couldn't read and write anymore. My whole concentration level went. I couldn't focus. My parents took me out of normal school into a private school where nobody could see that I was out of order, completely out of order. I developed massive food sensitivities, allergies, food sensitivities against many different things and constant diarrhea, asthma, eczema in my elbows and knees, and the whole thing really went crazy. And this was my start into this world. Lucky we found a teacher who had an overview and said, look, it's impossible going from very clever to like that. This was like a huge step. And he started to explain to my parents how amalgam fumes out all the time mercury poison, mercury into the teeth, especially when you rub the tooth or when you eat something warm. Those fumes go out in really massive ways and they start to pollute the body more and more. Now, if you have 2 metals beside each other, the higher quality palladium or titanium will then corrode the mercury even faster, so it releases even more into the body. And they've done some tests where they implanted radio-labeled mercury into a sheep's tooth or into a monkey, and then afterwards, after 24 hours, did the test, and you can see here kidneys, liver, the whole stomach, all the intestines, everything was polluted, including the mouth. Plus, it went into the brain, and you can see that in the monkey as well, quite a strong concentration in the brain. And that's why when you see mercury traveling then through meridians, like in my case, it was the back molars, it was the back teeth, which were filled and polluted, and then even with a root canal filled tooth. And that traveled to the small intestine. I had problems with the heart. I couldn't run. I couldn't, do excessive long-term exercise. So everything went haywire. Same thing here. So understanding how that all comes together, and then you do a test. And like we say, if you have 1 test, like a hair mineral analysis, that's a suspicion. If you have 2 tests and you add chelation therapy on top, or you do the tree test, which is already all 3, then you see fresh pollution, residual pollution, and deep tissue pollution all at once. And then you can say how toxic the body actually is. But if you just look at the symptoms of heavy metal pollution, it's quite intense. There is so many signs that indicate that problem. Now, on my journey, looking for solutions, going through many chelation therapies, I had so many IV chelations that, where they built the body up with all sorts of minerals and vitamins, and then you do the chelation and again and chelate again, just to get that heavy metal load down. Now, that was when I met Dr. Gordon, and he put me on Beyond Chelation, which unfortunately isn't available. It was a package with 5 pills, all the different things your body needs to detoxify. Really great. And I started that almost for 2 years. And when you look at my tests before and after, actually nothing really changed. It was frustrating. And many of you have probably noticed when you do heavy metal detox, it doesn't go that fast. It's a very, very slow motion process. And that's Dr. Gordon as well introduced us to PMF. And he said, well, just start doing that and use PMF and then take medication, do all your sweating and exercise and get toxins out. And we started PMF, and that was before, and I was still quite high in mercury. When we started out, I was way off the chart. And then it was coming down, all my cadmium, all the toxins were coming down, lead poisoning. And then after, it went down. So it's a real great thing. And zeolite spray and all of those things were introduced to me by my friend, Gary. I really like him. So, you know, a curse turned into a blessing because I learned about detox more than many will do. And I tried everything and I went through all the processes. And that's why, welcome back to Functional Medicine for Health Professionals. How to treat cancer patients without treating cancer. And we can widen that spectrum. How to treat any patient with chronic degenerative disease without treating the disease. Now, I promised you in this video we look at toxins, and not so much on toxins, what they do and where they come from, whereas I have to mention a few, but more about the detox pathways. So let's just go into that and have a look not only at heavy metals and all those toxins and chemical toxins, but also at neurotoxins, toxins that come from infections, from teeth, from gut biome and all of that. Now, you know, when you are born, especially in our time today, children have 287 toxins right at birth. 134 of these cause cancer, 158 toxins in the brain and nervous system, 186 infertility, and 151 birth defects, abnormal development. Now, if you add that number, then you come a lot more than 280. So many of them cause multiple of those disorders. And when you look at the widespread spectrum of toxins, it's not quite that easy to find out where your pollution comes from. We have dental toxins, like I mentioned before, which was my initiation, my real big problem. When you have a high quality gold, for example, beside an amalgam tooth, then that high quality will corrode that lower quality metal a lot faster. In the same way, you have here an abscess, which is a high bacteria load. Now, when you think your bone looks like this, it looks like a coral reef. Thousands of bacteria are breeding in those holes and in those tubules. And if that, you pull the tooth, it closes up on top, and then you have underneath gangrene. It's a massive load of bacterial waste that then travels into the bloodstream with high pressure pressed into the bloodstream because bacteria build gas. And then you find those big pockets that then corrode or erode the complete bone. Then you have dysbiosis in the gut bacteria. And there is many what we call anaerobic bacteria. They don't need oxygen. Now, the biggest problem that causes leaky gut is lack of oxygen. So if you have no oxygen in the gut, there is anaerobic bacteria overgrowth, then that causes massive leaky gut, and the repair is not possible because your immune system, as we know, needs to repair massive amounts of oxygen. So changing the milieu, oxygenating the colon and the small intestine is such an important path. So chemical toxins, environmental toxins, bacterial, dietary and medication toxins, as we know, there's plenty of those too. And let me just go back. And then we have viral and bacterial infections in massive ways. And they are not clean as they were. They're now antibiotic resistant superbugs. And then there's all those non-heavy metal toxins, chemicals, which are in our environment. And when you just look at the GPL tox and all the diseases that are associated with them, well, that's pretty scary, isn't it? I found that really bad. Now, in my quest and in my search for solutions for toxicity, I came across Dr. Mutter in Germany, and he has a few very, very brilliant presentations, and I went to speak with him. And the concept that he explained is that when you have a lethal dose, LD 1, so 1 out of 100 rats die out of that lethal dose, then you go up to lethal dose 100, that's when all the rats die of those 100. And that gives you a very clear indication how dangerous something is. So if you take a lethal dose 1 of lead and a lethal dose of mercury of 1, and you add them, just put those two together and give those to the rats, 100 rats die. So 1 and 1 does not make 2, it makes 100. In the same way, when we have other toxins like cadmium and arsenic, if they are combined with other toxins, they become 10 times, 20 times, 50 times more toxic. So when you see we're already born with a massive load and then we accumulate over lifetime, no wonder that we all get sick. Heavy metals are probably, or not probably, they're actually underlying every single problem, whether that's autism, ADD, ADHD, ALS, infertility, Crohn's disease, depression. You can read the list yourself, and probably that's not even a fraction of what it is. Now, heart problems, everything related to heavy metals and toxicity. And like I said before, they're direct carcinogens. And that's why we have more and more babies being born with open tumors and brain tumors and tumors behind their eyes. They're mutagens, so they affect downstream the genetic expression. And they're teratogens, which actually completely create disformity and organ, collapse or disformation in the system. Now, there is another problem. We not only have heavy metal making it 100 times worse. We also have bacteria influencing mercury or heavy metals. So if you have, for example, bacteria overgrowth in a cavitation, and you have beside that a tooth with heavy metals, with mercury filling, then those bacteria transform those heavy metals, mercury, into dimethylmercury, which is so highly toxic that there is no way to survive. Actually, one of the scientists, Professor Karen Wetterhahn in the United States, they were experimenting and trying and created dimethylmercury with bacteria, different types of bacteria. And she was exposed to one drop that went through her glove onto her hand. And she couldn't wash it off fast enough. And 6 months later, she died. I think we're not aware of how toxic our environment has become. And that's why I always say, when you look back at Max Gerson and Budwig diet and all of that, that was 80 years ago, 90 years ago. They had not that exposure. They had deficiencies, they had inflammation, that smaller problems. We live in a world today which is really, really dangerous, and just adding mold toxicity to heavy metal makes the whole detox process impossible. Actually, mold stops your detoxification pathways. It blocks NRF2. NRF2 triggers from every cell all the transporters that take toxins out and take nutrients in. So when you have those transporters blocked and the cell is not repairing itself, is not detoxifying well, then nothing works. So if you have mold exposure, what do you want to do first? Do you want to, detoxify heavy metals? Really bad idea. You first need to get rid of the mold. And that's why ozone is a great tool, because it triggers NRF2, but it also triggers a complete killing of the mold. And in that case, I wouldn't even start with, I would continue with it, but I would start out with a very high intensity treatment, like a 10-pass treatment, IV, to really get a massive shock through the body, kill off as many spores as you have, and boost your immune system to work. So many different things. Let me just go back. If you just look at some of those brain and psychiatric problems, brain problems on its own, speaking, concentration difficulties, mercury goes directly into the brain. It affects eyes, skin, nose, sinus, hearing, throat and lungs, mouth. Heart problems, like I said before, it directly affects the heart, liver, kidney. It's a general toxin for the whole body and affects you on so many ways. So for people always ask me, Marcus, I have still a few mercury fillings and I have cancer and I have this. Would you recommend to take it out? And this is detox. I can't get it out of the body when I still absorb it. So teeth are really mandatory. And you can do a lot. You can prepare. You can, prepare before you go to the dentist in a massive way. Protect your whole system. Build your whole system up. And then go to a conscious dentist that helps you to get those heavy metals out. It's not an easy process. Once the body has been contaminated, it's actually a slow motion thing. Now, There is a lot of people that detoxify heavy metals in, let's say, 130 days. This is the normal cycle that you detoxify. And there is a few very fast ones. You know that all DNA SNPs work. Then you have the middle on around 30 to 60 days. That's the majority of people. And then you have slow detoxifiers, and then you have no detoxifiers. They don't detoxify. Their systems are blocked either by mold exposure, or by massive deficiencies. So knowing that, instead of just pushing the toxins out and then polluting the body more, we have to look at many of those different pathways. And before we go into that, and I'll explain you a bit of the technicality, I would like to make you aware of one thing. When your liver detoxifies, this is the liver. You have first liver detox phase 1 is in each cell. Every single cell pushes toxins out, like I said before, via those transporters. As soon as you have a slight oxidative stress, like ozone, and you have that trigger switch, NRF2, then your cells start to detoxify. Now everything gathers in the plasma, and from there it's taken into the blood. In the blood, it travels to the liver, and detox phase 2, which most of them call 1, is that detox phase where it's made water soluble. The fats that are bound to the toxins are usually fat soluble. So it comes into liver detox phase 2, and then it's made water soluble so that it can be eliminated. Now, if this phase is active, very active, you make actually out of a relatively harmless, or well, it's still a heavy metal, but you make it even more toxic because it's water soluble. It can be absorbed by every cell. So it becomes highly critical. And then look where it goes. Into that green line, which is your bile duct. And then the gallbladder uses bile salts and bile into here, and then it goes into the pancreas. So if we look at the cross section, all toxins from the liver go through this bile duct. And here, this is the pancreas, which sits about here. And this pancreas then releases together into the small intestine. This is right after the stomach. You see that? Right in this first curve, all toxins are eliminated. Now guess where they go? They go through meters of small intestine. And that's what we see in the next picture. All of this small intestine, where 80% is reabsorbed. So what do we need to do in order to get rid of toxins when they are detoxified, when they are shot here into the small intestine? We need plenty of binders, fiber. That's why the Gerson therapy just not only uses the juices to detoxify, they also eat a lot. They have a lot of binders and fiber to carry those toxins out. Really important. And that's where we add also modified citrus pectin and many things to carry the toxins through that small intestine, through the colon, to be eliminated and not to be reabsorbed. Very important. Also, you see the blue lines, the blue veins that go all directly back into the liver. You have blood circulation to the intestines, and then all that goes through that portal vein back into the liver. So when you reabsorb, it's going through that same process again. Guess that your liver gets tired. When we look at those images here, when you have inflammation in your small intestine or SIBO, overgrowth, can your body detoxify? It's actually one of those big problems that we have. As soon as you have ulcerative colitis, Crohn's disease or any IBS, any kind of inflammation in your gut, the process of detoxification is stopped, which means your liver detoxifies and can't let go. So much of that is then sent into the kidneys, which causes pretty big harm. So it's not, inflammation is the first thing to get rid of. Then we need to get rid of infections like mold toxicity. And then we can start with heavy metal. And see, for me, the main focus here is always make it logical, make it clean, make it understandable, so that when our coaches go through the program, that they don't cause harm. We need to understand the hepatic system, right? The liver, how it works. So if you look at the liver and all the detox profiles, what nutrients are required for phase 1, actually phase 2 in our case, and what do I need to support the liver with so that it can break those toxins down. Then we have the intermediate stage, which is when the toxins are even a lot more toxic because they are fat and are less fat soluble or water soluble. And in that highly reactive substance, we need a lot of antioxidant support. And then we go into phase 2 before the elimination comes, and that's where we need plenty of amino acids, which need to be triggered with the right base minerals and the right trigger support. So understanding those things, learning about them before we just give someone cilantro to detoxify or give some kind of herbal remedies to push out toxins is really crucial. And like I said to you before, functional medicine is not just advice, general advice. It's very specific for each patient. So looking at how their system works, how their individual system are prepared, how the nutritional status is for all of those systems, which is, different. Not your heart needs different minerals and fats, vitamins than your intestine does. So knowing what we need to support that process is really crucial. Now, liver, I won't go into detail, but when you look here, how to support the liver, phase 1 support, cruciferous vegetables, broccoli, cauliflower, herbs, milk thistle, everything which is bitter, things we usually don't like to eat. So you have all your bitters. In Germany, still old recipes of all the different bitters in a little drink, and it's not very nice. And then vitamin C, E, Q10, selenium, really, really important. And then supporting phase 2. Again, I would like to know, is my phase 2 actually working? If I have high inflammation in my gut and I push detox 2 and nothing can go out because my body doesn't allow it, it doesn't feed into an inflamed stomach or inflamed small intestine, then the whole thing won't work. So again, getting a diet which takes inflammation out of the colon and out of your small intestine is prime. That's the first thing. So taking food sensitivities out, taking harsh fibers out, making the stomach heal, and then adding the detox into the program makes much more sense. Now, supporting the liver with mercury detox, for example, we know chelation, zinc, selenium, modified alginates, chlorella, very important mineral antagonist and sources, how to get them. And then we need to add natural chelators that help to detoxify that whole system at once. Now, I wouldn't know any of that. I wouldn't remember. If you don't do it every day, it's gone, right? And that's why everything is in the app. If you look for heavy metal detox and you look in the detox channel, you will find that all of that information is there. And it triggers, it shows you which tests, which minerals, which supplements, which nutrients, the process, what to watch out for. And there is a lot more. I cannot even pack a fraction of what we need to know about detox into this slide. But what I would like to tell you is one very, very important fact. You have heavy metals, not only in each cell, they are also dogged on to the cell. Inside the cell, they cause havoc. Outside, they block the nutrient uptake. And intracellular, when they are in the plasma, in the matrix, that's when they can be eliminated and brought out. So when you understand the concept of heavy metal poisoning or any toxin in your system, it makes it pretty clear that when this fluid, this is the most relevant, is sticky and gooey and too acidic and not flushing properly, then toxins can't be detoxified. Actually, the membrane of each cell closes up. So when I talked about in the beginning making an impact, make a very fast change in alkalining the body, this is when this fluid all of a sudden can release toxins. This is when the cells open up to release all the toxins into the system. If this is nutrient rich and has enough binders, well, then the toxins released. The membrane is highly intelligent. If you know the work of Bruce Lipton, then you realize that it's not the nuclei, it's not the cell core that is intelligent, it's the membrane. It has so many channels and nutrient channels which are to excrete and to intake, and they need to work. And that's why using PMF for detoxification makes such a massive difference. First of all, you energize the cells. You just give them the energy to do the work. Secondary, you shake all those pathways, all those detox pathways and nutrient intake pathways, you shake all the channels free, which means the cell can suddenly breathe, can start working. ATP production is enhanced. That's why pain goes away, energy levels go up. People feel great because that effect cleans out the membrane of the cell. Now you can see here, this is a lipid profile. Now this folds up, it clogs up, it doesn't work anymore. All the membrane channels close down. And then the cell goes into a fermentative state, which is what we know cancer is. Now, as soon as they start breathing oxygen, take glucose and minerals and vitamins in, that's when it can produce ATP. So opening those cells with PMF and shaking all the heavy metals free into the plasma, which is alkaline, and all of a sudden the body can detoxify. Plus, you have a strong charged cell. But if they go and dog on, or they even go through those particles, then it doesn't work. Now for me, one of the most logical things was when I understood that they are charged, negative charged. And your cells, the dogs, those little channels, they're charged as well. So as soon as you have nothing to hold on to heavy metals, they just go back on. And then the same system, you release and you set back on. Those which go through the liver pathway and are detoxified and transformed become even more toxic and more susceptible to be absorbed by any cell. So having binders, priming the body, and not just once, spray and detoxify doesn't work. You need to do that over a long period of time. Use different binders, vary, use different things to detoxify the body. Not one does it all. It's like if you have a house to be built, it's not only a hammer, you need a screwdriver and pretty much any other tool. In the same way, if you detoxify, you need many different things. And that's why whether you use clay or you use zeolite or alginates or whatever, just vary and take them on board and use them over a longer period of time. And then help your body to detoxify, get rid of toxins. Now there is many different ways. You realized before in that one image we saw that you can detoxify via kidneys, via liver, into the bile, into the colon, and then throughout the GIT, intestines and tract, or through the skin. So all of that is processed in the liver. So we always need to have that support going in the first place. And then we can pull it out through the skin, which is really great. Helps the body dramatically because it cleans out fat tissue at a superficial level. We also can add coffee enemas where we clean out the colon. If we add the proper minerals and fibers and binders to our diet, then it is not reabsorbed. We can do certain things like chelation, but they are very taxing. They are very taxing for the kidneys. So it's not a process you do all the time. It's actually only in very critical situations advisable. So rather do it on an ongoing basis. Enemas are really, really great. And then we go through oil pulling. Fantastic. If you have your mouth full with toxins, bacteria overgrowth, or you have had mercury, it's not only in your teeth. So when they take the tooth out, the bone is still full, the gum, all the meat, the flesh around has absorbed those particles just in the same way. So flushing oil, spitting it out, really powerful. Clay bath, fine for red sauna, hypothermia, IV infusions, glutathione and vitamin C infusions, really helpful here, and so on. Detoxification is not something you do once and then it's done. It's actually a process. And doing it in the right sequence, knowing what to look out for, is what we learn. I had many Herxheimer reactions because I thought I was doing the right thing. And then someone said, no, it's not. And then you learn a new way, and then you learn another way. And then you realize, oh, this is because in my body, this doesn't work. And we've had so many DNA tests, so many SNPs, so many people that have pathways blocked. So looking at this whole concept from an intelligent viewpoint and standpoint, and then knowing what works best, realizing the liver detox profile, which pathways work, which one works fast, which ones work slow, makes a hell of a difference. And that's what we try to teach you in this training. Now, next one, and probably one of the most important that we need to address, is the mind, stress, trauma. And that's what we will do in the next video. Stress is probably one of the biggest catalysts, and every single person that has cancer or has a strong chronic degenerative disease only got there after it was triggered by a traumatic event, by an accident, by something that shocked their system, and that allowed the immune system to shut down and start the process. Chronic stress is even worse because it completely immobilizes certain systems. So knowing how they are immobilized, what happens, is what we look in next. Now, many of you have asked, Marcus, can you tell us where functional medicine sits? Where does it fit into the whole game? We have doctors and chiropractors and nutritionists, and then we have on the other side health coaches, fitness coaches, wellness coaches, Reiki healers, Bowen, physiotherapists, yoga teachers. You know, many different aspects that deal with one little field. Whereas the main overview that you need to address chronic degenerative diseases is kind of a void. I call it the black hole. Doctors have no idea about many of those factors. Nutrition, they might know about different body systems, but not how they are interlinked. They don't know that your teeth are connected with organs via meridians. Very few have knowledge about hormones. They're specialized in their field of what they do. If you have hormone problems, go to a hormone doctor. If you have intestinal problems, go to an intestinal doctor. You know, it's separated in systems and organs, so they don't know the lot. And when you look at functional medicine, and especially what we teach, it covers treatments, many different treatments, non-toxic treatments, or even conventional treatments that we combine or that we reduce the side effects with additional treatments. We look at toxins and detox pathways and how to help the body, like I said today, in a systematic process, taking the first problem away, which prevents the detox pathway, supporting different systems so that the body can actually get rid of toxins at all. Very important. Then we look at the lab test and different tests that we can use to confirm what we're doing. We look at dealing with the side effects of chemo and radiation, how to help a patient, and not just to talk them out. Sometimes it can help, but then alleviate the problems. We look at dietary, which is food coach, nutritional coach, just more based on individual needs. We look at all the body systems and how we support them and how they can actually trigger the problem in the first place. We learn about hormones, about stress, about supplementation, lifestyle, and then many nuggets of gold. See, when we traveled from doctor to doctor, we learned so many things which are of relevance, like that your teeth are connected to certain organs, that meridians and toxins travel along, that it's actually not the toxins which cause cancer, or the cancer pulls all the toxins in. It's actually a detox problem. When your body cannot detoxify locally because of an impairment, because of a weakness, because of a deficiency, because of an infection. Like I said, mold. You realize in a house you don't have mold everywhere, but you have it in certain corners. In the same way, you can have certain organs affected with mold. Detox doesn't work. NRF2 is shut down. Protection doesn't work. Enzyme function is impaired. And that's when then we start to build that cancer. So dissolving it from the root cause out is what we try to do. So these are the nuggets of gold that we share with you, which we've learned. And look, I say it all the time, I'm grateful for all the help that we've gotten from all those passionate doctors over years. And packing that into the program really makes sense. And look, this is what actually doctors should know, but they're too specialized in their field. This is what they should actually learn, but it's too much for most. They focus on one small part and think that's the lot. But there is so much more, and that's why functional medicine is kind of a void. It's a huge need that the world needs and patients need, and that's what we try to fill. Now, if you haven't filled out the form, do so. Simply click in this video or underneath the link and fill out a short questionnaire. When you come to booking the time with me, just forget about it. Just don't do it. I think it's now end of February. Way too long, so ignore that and just fill out the form. I will contact you as soon as I can. We've set up a team that will call every single person that has filled out those forms and will make an appointment and pre-filter those who really fit into our program. See, functional medicine is not for everyone, and we try to build a team of very integer, very passionate people to take that into the world. Help me to, spread the light, share the light that I've received from many of those doctors and take it out to those who need it most. All right? And now, click the yellow link, fill out the form, join our team, and I'm looking forward to see you in our next video where we talk about stress.